For my final teaching project, I decided to focus on health promotion in school-aged children, and specifically on improving oral care in children with autism. So what is autism? According to the DSM-5 diagnostic criteria, for someone to have autism, they must have deficits in 3 areas of social communication and interaction. Some of these areas include failure to initiate or respond to social interactions, deficits in nonverbal communicative behaviors such as poor eye contact, deficits in understanding relationships. A lot of times these children like to play alone. They don't like to be in big group settings. They become very shy when others talk to them. Repetitive behaviors such as lining up toys. They will also do like hand flapping, things like that. Or they also may have hypo or hyper reactivity to sensory input. So a lot of times these children don't like loud noises. Bright lights can bother them, little things like that. I chose this group because working in recovery and surgery area, I've noticed that a lot of children coming in with poor oral health and having to have surgeries are children with learning disabilities. And I think a lot of it is because they're having a hard time communicating um, with the parent or the parent communicating with the child on how to properly provide dental care at home. So I think this is a good learning opportunity to teach the parent as well as the child how to improve dental care at home. So the teaching goal for this project would be for a child without assistance to be able to demonstrate how to correctly brush their teeth. Some of the measurable goals would be after reviewing the oral health visual aid with the nurse, the child will demonstrate how to apply toothpaste on his or her toothbrush. After reviewing the oral health visual aid with the nurse, the child will list and order the steps to brushing their teeth, and they can do this either verbally or with visual aids because some of these children are nonverbal. And then using the oral health visual aid, the child will correctly brush their teeth, cleaning all sides of their teeth in all 4 domains 5 times. Assessing learning needs in this group is crucial since the diagnosis of autism was quite broad. One child with ASD diagnosis may have several different learning needs than another. So a thorough assessment would be first priority before establishing your teaching method. A structured interview is a good resource to use with parent and child to determine learning needs. Nadu and Singh states children with ASD tend to process visual information more efficiently than auditory information. So for this project, I decided to use a visual aid as my material. One-on-one sessions compared to group teaching is more efficient. As group teaching, the child becomes very distracted, may not like being in large groups. So one-on-one is easier for them to stay focused and to learn. Multiple cues and repetition is key when working with children with autism. And then always teach skills in context. So using simple statements and not using out of context information. According to Tong et al., barriers that they found for teaching oral health in schools was lack of knowledge by the teachers of teaching about the oral health, especially with children with learning disabilities, lack of training, and then also lack of teaching materials available to the teachers. The Stable 2019 states to determine learning needs, you must know the learner. So we really have to identify who the child is. Is the child verbal or are they nonverbal? This is a big factor in determining our teaching method. What is the child's previous experience with brushing their teeth? Do they currently brush their teeth but they just don't get all areas? Do they already know how to put toothpaste on their toothbrush? That kind of stuff. And then what are they comfortable with currently and what would they allow others to do? So for my son, for example, he wouldn't let anybody do anything for him. So for him, the teaching would be to direct him to do something instead of having a parent assist him. And then once you establish who the child is, then you can prioritize their needs and establish their goals. Before teaching can occur, we want to make sure that these children are ready to learn, that they're willing and able to participate. So making sure that the child has had adequate sleep that night, that it's not too late during the day for them, that they're too tired, or if they've had several breakdowns during the day, it may not be a good day for teaching to occur. Also, establishing a relationship with the educator is really important. Children with autism have a hard time trusting people that they don't know. So establishing a relationship can be very effective in making the teaching more efficient. The teaching method that I chose to use for this project is demonstration and teach back using a one-on-one session and visual aids. Um, when teaching the child, we want to use small portions of information given at one time, so it gives the child more time to process information. Like we said earlier, with the multiple cues and repetition is really going to help them to learn the process. And then during the demonstration, where the child is teaching back, the provider giving multiple cues to help the child will also be efficient. Two learning theories that I found that relate to this is social learning theory. So the child is learning by viewing others, again, by the visual aids there. And then the self-efficacy theory, like one is competent and capable of accomplishing a specific behavior, they're more likely to do that behavior. So this relates more towards the parents. In this study by Schertz et al., they studied confidence of parents in implementing teaching to their child with ASD, and they found that when the parent was given support and background information from providers and was part of the teaching process, then they were more confident in teaching their child than when they're just given strict guidelines and steps by a provider to teach their child. Materials that I used for this project include a visual board as seen here, a toothbrush, toothpaste, and water. And then I also included the option of pictures of a parent or sibling doing the task. So sometimes like more realistic pictures are easier for the child to understand than the graphics provided here. So they can use either or depending on the child's preference. And then I also included a parent brochure to assist with teaching at home. So kind of a lot of this information, but given in a brochure for the parent to review at home so they can help the child as well. I think this is age appropriate because the child is able to view the pictures and it's not all just verbal repetition and teaching. They're able to actually see what's going on, especially for the like 4 areas of the teeth that we're teaching to learn or teaching to clean. I numbered them so they kind of know the order to go into. My son is very into numbers, so he'll say like 1, I'll do this, 2, I'll do this. So when you number each section of the teeth, you can say, oh, let's clean 1, now let's clean 2. And he understands that a lot better than like front, bottom, and then like left, right. So just using little cues like that to help them with learning is really helpful. So this is an example, I mean, of using the parent or sibling and using actual pictures of the materials that you're using to help your child learn. And then also using characters or like things that they enjoy can make the process even more fun for them. So like my son likes Mario, so we got him a Mario toothbrush and he really likes using it. So to evaluate the effectiveness of the teaching, we want to make sure that the child is able to return demonstration of how to effectively clean their teeth. But depending on some of the children, if they're just allowing their parent to brush their teeth, that may be the main goal there. So basically looking at the child's learning needs and what they're allowing for the parent to do or themselves to do, you can see if the teaching was effective or not. Another thing you could see is if they're able to put in order the sequence of brushing their teeth. So the visual aid that I provided before actually are just little cue cards and they can put in order how to brush their teeth. And then also children that can speak, they can do a verbal feedback on what was taught. So first I'm going to do this, then I'm going to do this. And you can look at their learning by that. NATO and Singh showed 80% of autism patients at a dental visit use the visual board to help communicate with the dentist during their visit. So these visual boards are very helpful in communicating, and it can help decrease the stress level in the child because a lot of their frustration comes with not being able to effectively communicate with us. Some resources for parents and patients. On autismspeaks.com, they give a lot of um, education on autism, what it is. They provide a lot of research for autism on there, and they're also like big advocates for children with autism. So they give a lot of information, they give a lot of resources on their site as well, and then also they do a lot of activities and like community services for children with autism. So I always find this website is very helpful. Team PBS is an ABA service that we use with my son, and I found it very beneficial and helpful. They give a lot of information on what ABA is and resources that are available through there. Um, and then the CDC also has information on autism diagnosis, on different symptoms, and then different treatment options that you can use to help your child with autism. This here is a YouTube link that I found beneficial, and it was called a dental toolkit, and it gives information to parents about how to help their child with autism learn to brush their teeth. It gives information for the child and then also for the parent to help with teaching. And then this is just a quote that I liked. If you meet one person with autism, you've met one person with autism because they're all so different. Interprofessional and parent involvement. I added parent involvement on here because I feel like parents are very crucial in teaching their children with autism because the children really trust the parent, and a lot of time teaching occurs really well when a parent is involved. So using a visual aid at home can help the parent to independently teach their child good dental care. Oral healthcare professionals are also very important. Updating the provider on your child's limitations and strengths is really important when going to dental visits. So if a child doesn't like bright lights, they can try making the room a little dimmer. And then if they say like, oh, my child likes numbers, then they can use numbers as part of a tool in order to teach them oral care. So things like that can really help. One study by Bernath and Kanji found that increased understanding of ASD community and raise awareness among healthcare professionals to work towards diminishing the barriers to care for these patients. So they found a lot of barriers to teaching children with autism is that a lot of healthcare professionals don't know how. So just educating them more on that can help to teach these children in the future. ABA technicians and BCBAs are also very important. A lot of times they work one-on-one with our children and they're with them every day. So they do establish that great relationship and they usually respond really well to them. So they can actually add teeth brushing to their child's goals, and that can be one thing that they work on during their sessions. So they're a great tool to help with teeth brushing as well. And then in order to document the teaching and the learning that was taught. We can use graphs. They do that a lot in ABA, showing like the child was able to demonstrate teeth brushing this many days per week, and they can see if they're being consistent or if they're having trouble areas, and then they can adjust the teaching as accordingly. And then also if they're able to give teach back, and then if the parent is able to as well. And these are my references that I used.